Hello and welcome. Today we're diving deep into a fascinating and sometimes challenging condition, autoimmune pericarditis. This isn't your everyday heart issue. It's a complex interplay between your immune system and the delicate sac surrounding your heart, the pericardium. Join us as we unravel the intricacies of this condition, exploring its causes, symptoms, diagnosis, and the latest in treatment and management. So, what triggers autoimmune pericarditis? Well, the short answer is we don't always know. It's a condition where your immune system, designed to protect you, mistakenly attacks the pericardium. This can happen spontaneously, or it can be linked to underlying autoimmune diseases like lupus, rheumatoid arthritis, or even inflammatory bowel disease. Certain infections like viral infections can sometimes act as a trigger, causing the immune system to become confused and target the pericardium. In some cases, it can occur after a heart injury, surgery, or even certain medications. Identifying the exact cause can be challenging, but understanding the potential triggers is a key first step. Let's talk about what's actually happening inside your body when autoimmune pericarditis strikes. The pericardium, a thin, two-layered sac surrounding the heart, normally protects and lubricates it. In autoimmune pericarditis, the immune system launches an attack, causing inflammation of the pericardium. This inflammation leads to the buildup of fluid within the pericardial sac, a condition known as pericardial effusion. In severe cases, this fluid buildup can compress the heart, restricting its ability to pump blood effectively. This compression, known as cardiac tamponade, is a life-threatening emergency. The inflammation can also lead to the pericardium becoming thickened and scarred, a condition called constrictive pericarditis, which further restricts the heart's function. Autoimmune pericarditis isn't incredibly common, but it's also not exceptionally rare. It's difficult to pinpoint exact numbers because many cases might be mild and go undiagnosed. It affects people of all ages, but it tends to be more prevalent in younger individuals, particularly those with pre-existing autoimmune conditions. Women are also slightly more likely to be affected than men. Understanding the demographics of this condition helps doctors be more aware and consider it as a potential diagnosis, especially in patients presenting with chest pain or other related symptoms. The symptoms of autoimmune pericarditis can vary significantly, ranging from mild discomfort to severe, debilitating pain. The most common symptom is sharp, stabbing chest pain that is often relieved by sitting up and leaning forward, and worsened by lying down or breathing deeply. Other symptoms may include shortness of breath, fatigue, a low-grade fever, palpitations, or a rapid heartbeat, and sometimes even swelling in the legs or abdomen. It's crucial to note that the severity and presentation of these symptoms can differ from person to person, making diagnosis sometimes challenging. Diagnosing autoimmune pericarditis requires a combination of careful clinical evaluation and diagnostic testing. A doctor will start with a thorough physical exam and medical history, focusing on the patient's symptoms and any underlying autoimmune conditions. An electrocardiogram, or ECG, is a common test used to assess the heart's electrical activity and can show characteristic changes associated with pericarditis. A chest X-ray can help visualize the heart and lungs, looking for signs of pericardial effusion or other abnormalities. An echocardiogram, which uses sound waves to create an image of the heart, is essential for detecting fluid around the heart and assessing its function. Blood tests are crucial to look for markers of inflammation, such as elevated C-reactive protein or ESR, and to rule out other causes of pericarditis, like infection or kidney disease. In some cases, a pericardiocentesis, where fluid is drained from the pericardial sac, might be performed to analyze the fluid and look for signs of infection or malignancy. In rare cases, a CT scan or MRI may be useful. The process of diagnosis may take time as the physician will want to rule out other, more common, causes of chest pain. While autoimmune pericarditis itself isn't typically classified into distinct types, it's important to differentiate it from other forms of pericarditis, such as those caused by infection or injury. It's also important to determine if the pericarditis is acute, meaning it's a new onset, recurrent, meaning it comes and goes, or chronic, meaning it lasts for more than 3 months. Understanding the specific context of the pericarditis, whether it's related to a systemic autoimmune disease, triggered by a particular event, or idiopathic, meaning the cause is unknown, helps guide the most appropriate treatment approach. The treatment and management of autoimmune pericarditis focuses on reducing inflammation, relieving symptoms, and preventing complications. Medications like nonsteroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or naproxen, are often the first line of treatment to reduce pain and inflammation. Colchicine, an anti-inflammatory drug, is often added to NSAIDs to further reduce inflammation and prevent recurrent episodes. Corticosteroids, such as prednisone, might be used in more severe cases or when NSAIDs and colchicine are ineffective, but their long-term use can have significant side effects, so they are typically reserved for specific situations. If the pericarditis is linked to an underlying autoimmune disease, treatment will also focus on managing that underlying condition. In cases of cardiac tamponade, pericardiocentesis, or drainage of the fluid around the heart, is a life-saving procedure. Rarely, a pericardiectomy, or surgical removal of the pericardium, may be necessary in cases of constrictive pericarditis. Lifestyle modifications, such as rest and avoiding strenuous activity, are also an important part of the management plan. Unfortunately, there's no guaranteed way to completely prevent autoimmune pericarditis. However, managing underlying autoimmune diseases effectively can reduce the risk. Avoiding known triggers, such as certain medications or infections when possible, might also help. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate sleep, can support a healthy immune system. If you have a family history of autoimmune diseases, being aware of the potential risk and discussing it with your doctor can help with early detection and management. The prognosis for autoimmune pericarditis varies depending on the severity of the condition and the individual's response to treatment. Most people with acute pericarditis recover fully with appropriate treatment. However, recurrent episodes are not uncommon. In some cases, the condition can progress to constrictive pericarditis, which can significantly impact quality of life and require more aggressive treatment. Researchers are constantly exploring new ways to understand and treat autoimmune pericarditis. Recent advances include a better understanding of the immune pathways involved in the disease and the development of more targeted therapies. Studies are also investigating the potential role of biologic agents, which are medications that target specific parts of the immune system, in treating refractory cases of autoimmune pericarditis. Ongoing research promises to bring even more effective and personalized treatment options in the future, improving the outlook for those affected by this condition.